The point number 3 about the warfarin. The first, when you use warfarin, warfarin actually work against vitamin K. Okay. The first thing decrease the warfarin. Warfarin it decrease protein C and protein S also. This point is very important point. Listen carefully, okay? Warfarin, warfarin we use at what? We use as anticoagulant. Yeah, we use as anticoagulant. But the problem is that now the first problem here. The first deficiency of I already explained the short half life of factor number 7. The first deficiency there. Okay. Along with this, the protein C and protein S synthesis also decrease. Protein C and protein S. What is this protein? This protein, protein C and protein X, they activate what? This protein activate antithrombin 3. There are two pathways to break the clot. Okay, two pathways. The one thing is a natural anticoagulant. The natural anticoagulant antithrombin 3 and protein C and protein S. This protein C and S, they're doing what? They activate the some protein enzyme to break factor number 5, to break factor number 2. Understand or not? Okay. So protein C, listen carefully. Protein C, protein S is also anticoagulant. Okay, anticoagulant. When you use warfarin, the warfarin stop vitamin K. Yeah. So what happened? The protein C production also down. Protein S production also down. If protein C and protein S production also down, the initially warfarin doing what? Initially warfarin act like procoagulant. Initially warfarin sorry something here. Okay, let's continue. The protein C and protein S. The first warfarin, when you give warfarin to patient, what happen? The warfarin to patient, warfarin act like procoagulant. Okay, warfarin act like procoagulant. Must keep in mind here. When the procoagulant, what happen? It can induce skin necrosis. If you directly give warfarin, it can induce skin necrosis very easily, and especially if the person have genetic deficiency of some person have protein C deficiency. If the person have protein C, that naturally protein C deficiency. If the person have protein C deficiency, you must contraindicate warfarin that time. Okay, the warfarin, if the protein C deficiency, it can decrease your protein C level too low. Okay, so first the warfarin act like procoagulant. It can induce clotting. It can start. I'm using warfarin as anticoagulant. Yeah, you want to use as anticoagulant, but the warfarin now start clotting. How warfarin start clotting? Because warfarin also decrease the synthesis of protein C and protein S. This protein C, protein X act like anticoagulants. Yeah. So if this protein C, protein S break the clotting factor number 5, clotting factor number 8, clotting factor number 2. So this protein C, protein S by nature, okay? Naturally, they are anticoagulants. Naturally, they are anticoagulants. So if you decrease the quantity in your blood, what happens? Factor number 8, factor number 5, factor number 2, their half-life, their life will increase. Yeah. So they can make more clot. So warfarin induce what? Warfarin induce thrombosis under skin. Warfarin induce thrombosis. Understand? In initially, warfarin doing what? Warfarin make thrombus under skin and start skin necrosis. Especially in if the patient having naturally some genetic problem for the protein C deficiency. Protein C deficiency. It's a procoagulant genetic problem. Okay, protein C. If the protein C deficiency there, then we never use warfarin. Okay, this is a side effect of warfarin. Understand? I am using warfarin to break the clot. I am using warfarin against clotting system. But now warfarin doing what? Warfarin doing thrombosis. Understand or not? Okay. Clear? Understand? Warfarin doing thrombosis when you initially start warfarin to the patient. So now what you can do? What you can do? Before start warfarin, oh, give heparin. Before you start warfarin for prophylactically, it's a prophylaxis here. Because when you give warfarin to patient, write a sentence here. When you give warfarin to patient, the first what happen under the skin, more thrombosis. Why more thrombosis? Because warfarin decreases the synthesis of protein C and protein S. Okay, the other clotting factor still there. Their half-life is more than protein C and protein S. So protein C and protein S is going down in blood. If protein C, protein S going down in blood, it can make more thrombus. Understand? It lead to formation of clot. So that's why warfarin induce thrombosis under skin when you first give. Before giving warfarin, what you use? Give heparin. This part very important. You understand or not? Give heparin before using warfarin. First give heparin before giving warfarin. Heparin doing what? Heparin break your clotting factor number 3, clotting factor number 2. Heparin break the clotting factor. We already done with the heparin, yeah? So before using warfarin, why you use warfarin? For short term. For short term, give heparin first, then shift patient on warfarin, okay? We can't use warfarin like directly warfarin. First give heparin. First give heparin. Understand? Why? Because initially warfarin doing what? Warfarin making thrombus initially. The warfarin contraindicate in protein C deficiency. If a genetic problem, then we can't use warfarin. Okay? Understand this concept clear? Before using warfarin, give heparin. For what? Because warfarin make thrombus. Yeah. Firstly, warfarin doing clotting, then anti-clotting. First doing clotting, then anti-clotting. Understand? The first doing clotting, then anti-clotting. The first clotting under the skin necrosis is a side of skin necrosis is a side effect of warfarin. Understand? So if you use warfarin, there must be skin necrosis there. To prevent that side effect, to prevent the thrombosis, with the first initial use of warfarin, you must use heparin first. Okay, heparin use before warfarin. Heparin use before warfarin. Understand? Heparin use before warfarin. Okay. Now move on. The next thing and another point about the warfarin. Warfarin cross placenta. Warfarin cross placenta. Okay. Warfarin cross. So can you use in pregnancy? If warfarin cross placenta.
No, sir.
Story not finished yet. The warfarin cross placenta. Another important thing is a teratogenic. Oh, it's a teratogenic also and affect the fetus. So warfarin and warfarin contraindicated in pregnancy. Never use warfarin in pregnancy. Okay. Never use warfarin in pregnancy. Never use warfarin in pregnancy. Understand? Never use warfarin in pregnancy. In pregnancy, in pregnancy due to progesterone and estrogen, the chances for DVT. Okay. For prophylactically, we can use heparin. We can use heparin, but not use warfarin in pregnancy. Warfarin in pregnancy is contraindicated. Okay. Okay, now warfarin, now overdose. What we need here, if you use a lot of warfarin, I need warfarin antidote. What must be antidote? Think about it. What must be antidote for warfarin? Okay, heparin antidote, you understand protamine sulfate, yeah? Heparin antidote. In case of warfarin, what you can give to patient in case of warfarin? Hmm? What is the side of action of warfarin? It work against vitamin K. Give injection of vitamin K. Simple. If it work against vitamin K, give some injectable vitamin K. Give vitamin K. Oh, vitamin K. Give what? Vitamin K. So vitamin K is the antidote. Vitamin K. Vitamin K is the antidote for what? Understand? Vitamin K is the antidote for warfarin. First give vitamin K for reversal, okay? For immediate, another option may be there, FFP. This FFP for immediate reversal, for immediate reversal of. So what is FFP? So FFP is a product of blood, okay? Similar to the cryoprecipitate, FFP. It's like simple like it's plasma, okay? It's a plasma, FFP. It's a plasma. You know, plasma contain clotting factors. Of course, plasma have serum, yeah? Serum with the clotting factor and the plasma with clotting factor, yeah? Plasma with clotting factor. The plasma having is a filtered fraction, is a filtered fractioned plasma. It's a plasma. What is FFP? It's a plasma, okay? The plasma contain clotting factor. What the warfarin doing? Warfarin decrease the synthesis of clotting factor. You can give clotting factor in the form of plasma. Understand? Vitamin K enter to liver. Okay, warfarin. Which one is more better, FFP or vitamin K? What do you think about FFP and vitamin K? Warfarin very high. When you give vitamin K, vitamin K go against warfarin and act inside the liver. Yeah, warfarin decrease senses and vitamin K increase senses of clotting factor. Oh, it take time. I think it take time. Yeah, one person decrease the clotting factor, another person try to increase the clotting factor. Vitamin K take time. Understand? Vitamin K take time to produce clotting factor because of course to produce something it need time. Understand? To produce something it need time. To produce something it need time. Warfarin blocks senses of clotting factor, and vitamin K increase the senses of clotting factor. The vitamin K increase the sense of clotting factor. To produce the clotting factor, of course, you need time. So, what is the FFP? FFP is your preformed clotting factor. Is your preformed clotting factor. Yeah, you take some blood donor. You have blood donor and collect the plasma of that blood donor. Oh, this plasma have clotting factor. So immediate reversal by not mixing question. Okay, the first, for example, if warfarin cause bleeding, yeah, overdose causing bleeding now, so what you can do for patient own warfarin, the first requirement, immediate reversal, FFP. Understand? Because what is FFP? FFP is already preformed clotting factor in the plasma. It's a plasma have clotting factor, yeah. So more better, FFP. Understand? More better, FFP as compared to vitamin K. You can give vitamin K, but vitamin K take time for action. Okay, to reverse the action of warfarin, it need time. It need time. Okay, it's far. It take time. But we have two options here. We have two options here. If still not better, give PCC. What is PCC? Packed cell volume. Packed cell. Okay, packed cell. But we have, if the answer was there given in the option vitamin K and FFP, you must choose this. You must choose this. Okay. Which one more better? FFP is more better. That's all about warfarin. You guys understand about warfarin?
Yes, sir.
Heparin and warfarin. Now I think it's interesting now, yeah? Warfarin act on extrinsic pathway. Warfarin working against vitamin K. What to monitor warfarin, we need to perform PT, okay? We need to perform PT. Understand? Warfarin, when you give warfarin, the first what happen inside the patient? The first warfarin increase clotting under skin and causing skin necrosis. So what will be the side effect of warfarin? The skin necrosis. The side effect of warfarin, skin necrosis. Okay, to prevent this side effect, what you can do for patient? Give heparin before using warfarin. Understand? Give heparin before using warfarin. Okay, warfarin contraindicated in protein C deficiency. Warfarin contraindicated in pregnancy. Understand? Warfarin contraindicated in pregnancy. Warfarin contraindicated in protein C deficiency. Protein C deficiency. Clear or not? Okay. Done. I ask you one question. If you remember nephrotic syndrome, I just this question come in my mind. Oh, you remember nephrotic syndrome? Just simple question. Then we move on. Nephrotic syndrome. What happened in nephrotic syndrome? Also hypercoagulability and chances for DVT in the baby. Minimal change disease, yeah, very common cause of nephrotic syndrome in children, membranous nephropathy in adult, also chance for DVT. So what you can use for DVT prophylaxis in that nephrotic syndrome patient? I just give you hint here. Antithrombin 3. Why clotting there? Why clotting in DVT in nephrotic syndrome patient? This antithrombin 3 going in urine. Selective albumin, selective protein urea, non-selective. In non-selective, every protein going out. So antithrombin 3 is going out, antithrombin 3 deficiency due to nephrotic syndrome. So why clotting there? Because no antithrombin 3. Now, let me know which drug you prefer from for nephrotic syndrome patient, warfarin or heparin?
Warfarin.
Why you not go for heparin?
Because warfarin produce against no, sorry. Because warfarin work against vitamin K, which vitamin K produce help factor 5-7.
Okay. It's okay. No, but why you not? You just explain why. But why you not go against? I wanna ask here. Why you not go for heparin?
Oh, because no kidney, because heparin need kidney function.
No. Heparin. You can use. Listen here. You can use low molecular weight heparin. It's okay. You can use and I have two type of heparin. No need to worry about the kidney function. Already the things written in front of you. Why you not go for heparin?
Because heparin block the intrinsic factor.
How heparin? Listen. How heparin work? Can heparin work directly go on factor number 2 and break that factor number 2? No. Heparin work. How antithrombin work? Antithrombin work with the help of heparin. Okay. Heparin attached with antithrombin 3. Then antithrombin 3 go against. Understand? Antithrombin 3 go against the factor number 2. So we need antithrombin 3 for heparin for proper working. Understand? Heparin is not an anticoagulant alone. Heparin work with antithrombin 3. Understand or not? Again, listen. Heparin, how heparin work? Heparin work with antithrombin 3. Clear? Heparin work with antithrombin 3. If you not have antithrombin 3, how heparin can work? Idea clear or not? If you not have antithrombin 3, how heparin can work? Heparin not work, yeah? Heparin is not anticoagulant without antithrombin 3. I give you heparin, okay? In your body, you not have antithrombin 3. Can this heparin break that clot or not and stop the propagation of the thrombus? Act like anticoagulant? No. If you not have antithrombin 3 in your body, heparin is just heparin. Heparin is not anticlotting. Clear? When I explain the heparin, the action of heparin. How heparin working? Heparin works with the help of antithrombin 3. Understand? Heparin attached with antithrombin 3, then antithrombin 3 become active. Now this antithrombin 3 go against this thrombin. Understand? Clear? So in nephrotic syndrome, antithrombin 3 is lost in urine. That's why it's lead to clotting, okay? This is the reason why clotting there. And you can't use heparin because heparin there can't work properly. If the patient have genetic deficiency of heparin antithrombin 3, again go for warfarin because it's useless to use heparin. Understand? Clear? That question clear or not?
Yes, sir.
Yeah, nephrotic syndrome, you not have antithrombin 3. Okay? Okay, move on. Next one. We finish warfarin, we finish heparin. Now move on, next one. Factor number 10, inhibitor, okay? Inhibitor of factor number 10. Apixaban. You can memorize like this factor number 10A, okay? Apixaban and rivaroxaban. Apixaban, rivaroxaban. Rivaroxa, this one is R. Rivaroxaban. Apixaban, rivaroxaban. Apixaban, rivaroxaban, they work against factor number 10. They block factor number 10, okay? They inhibit here. X A is your factor number 10. Just add bond. Rivaroxaban, apixaban. Understand? Exaban, apixaban, rivaroxaban, rivaroxa. Understand? Rivaroxaban. You can memorize XA. Okay. Factor number Fact number 2. Dabigatran. Name a bit difficult. Okay. Dabigatran. Argatroban. Argatroban. Dabigatran, argatroban. And these two drugs are thrombin, this prothrombin, factor number 2. They work again. These are inhibitor, okay? They inhibit factor number 10. Sorry, factor number 2. So, factor number 2 and factor number 10. So you can block this, okay? Another site of action. So these 4 done. Warfarin, heparin, the drugs working against factor number 10. Warfarin and drugs working against factor number 2. So all these drugs, heparin, warfarin, and factor number 10 inhibitor, factor number 2 inhibitor. What are the uses of these drugs? Heparin, if any patient come in hospital, okay, any patient come in hospital, have longer stay in hospital, any patient, chronic disease patient, you must give heparin for prophylaxis from DVT. So DVT prophylaxis, if person have the risk of DVT, prophylaxis from embolism, prophylaxis from the coronary, like a stroke patient, in the stroke patient, but to not allowed to make the clot there, okay, not allowed to make the clot there. So you can use these drugs. Understand? If the clot is already formed, so these drugs for prophylaxis against clot formation, prophylaxis against clot formation. Understand? Thromboembolism, pulmonary embolism, DVT, stroke patient. Understand? Thromboembolism, DVT, and stroke patient. In a stroke patient, so we can use these drugs, heparin, warfarin. So if heparin and warfarin are contraindicated, then you can go for factor number 10 inhibitor and factor number, these are new drugs, okay, factor number 2 inhibitors, factor number 10 inhibitors and factor number 2 inhibitors. Clear? Okay, and if the clot is already formed, clot is already formed, that time you need to use here. If clot is already formed, that time you need to break this clot, thrombolytic. That's a fibrinolytic system. This is your fibrinolytic system. If the clot is already formed, then you use thrombolytic. The thrombolytic, like the patient, if it's very easy idea to understand thrombolytics, what time we use. Early MI. First keep in mind this word, okay? Early brain stroke. Because why you have MI? Because thrombus is already formed. Clear? Why you have MI? If the patient have DVT, listen carefully the case. If the patient have DVT now presented with hemoptysis and chest pain and have tachycardia or pulmonary embolism, because clot is already there, okay? Clot is already there, severe pulmonary embolism. So you try to break that clot. You try to break that clot. How you can do this? You need to use fibrinolytic. If you remember the system, fibrinolytic system. So what is fibrinolytic system? Plasminogen. Plasminogen change to plasmin. This plasmin break that clot, break the fibrin, okay? Fibrinolytic system. So how we active this? How we active this? Here the drug family here plays streptokinase, LT plays, LT plays, Reti plays, Tanicti plays, Tanicti plays. Reti plays, Tanicti plays, LT plays. Reti plays, Tanicti plays, LT plays, okay? LT, Reti, Tanicti. And the first one is derived, these are synthetic, okay? The first one derived is very important, derived from bacteria. If you remember streptococcus, the streptococcus they having streptokinase. 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 So all these drugs, LT plays, Reti plays, Tenacti plays, streptokinase. All these drugs, this they known as they help what? Fibrinolytic system. What was the clot? Factor number 10 till factor number 10 you know. After 10 factor number 2. After 2 factor number 1. What is factor number 1? Fibrinogen change to fibrin. Yeah, this you know. If you want, this is your clot. This is your thrombus. Clot known as thrombus. Okay. If you want to break it, I need fibrinolytic system. Okay. Because you're breaking the clot, so you also can give name because of thrombus, yeah? Thrombolytics. Thrombolytics and fibrinolytics. Thrombolytics and these are the same names. Fibrinolytic is the system working inside your body. When you have the clot formation, to break that clot, you having normal physiological mechanism, plasminogen activate. The plasminogen change to plasmin and plasmin break that clot. Understand? To activate that plasminogen to plasmin, we need to use streptokinase, LT-plase, retiplase, tenecteplase, plase family, okay? Plase family. Understand? These are very strong. Must keep in mind. If patient have previous surgery, if patient have had trauma previous, like the 1 week ago or 1 month have had trauma, any bleeding problem previous, any bleeding history, okay? If patient have had trauma, patient have surgery, patient have an hypertensive patient, I must contraindicate fibrinolytic. I can't use. Keep in mind the contraindication more important, okay? Contraindication very important because fibrinolytics, thrombolytics, this is a drug of emergency. I can't use like for normal person or stable patient. What time you use? MI patient on the table of death. Yeah, brain stroke patient on table of death. At that time, you try to break that plot. Understand not? You try to break that plot, break that thrombus. To break that thrombus, you have just a limited time within 1 hour, maximum 1 hour, 90 minutes, 30 minutes. You have to break that plot. Clear? That clot, you must break that clot. To break that clot, I'm gonna use thrombolytics. Understand? I'm gonna use thrombolytics. So what the contraindication? If patient have hypertension, thrombolytics you must avoid because they can lead to very strong bleeding tendency. If the patient have recent surgery, patient have recent surgery, patient have any, clear or not, any bleeding problem before, any bleeding problem, active bleeding, like trauma patient have active bleeding, yeah, trauma patient active bleeding. If have any bleeding problem before, then patient have any previous hemorrhagic stroke, before have hemorrhagic stroke, any previous hemorrhagic stroke, not ischemic, I'm not mentioning here ischemic, okay, hemorrhagic stroke, hemorrhage inside the brain, previous surgery, previous bleeding, okay, previous hemorrhagic stroke, and patient hypertensive, and patient hypertensive. These four contraindication must keep in mind for streptokinase, for altiplase, retiplase, and ectiplase. Understand? Clear or not? At what time we use thrombolytics? At what time? When the clot is already formed. Understand? When the clot is already formed. If the clot is already formed, to break that clot, I need to activate fibrinolytic system. How you can activate fibrinolytic system? Plasminogen converted to plasmin. You need to help this conversion, yeah, by using altiplase, retiplase, connectivelase, and streptokinase. Done. So this is your fibrinolytic system. This is all about anticoagulant drugs and antiplatelet left. Tomorrow, inshallah, we'll continue with antiplatelet. More easy than this. This one a bit tricky. Okay. Heparin, warfarin, factor 10 drugs, and factor 2 drugs we use for prophylaxis for pulmonary embolism, thromboembolism, prophylaxis for brain stroke, prophylaxis for next time in Jana or MI, prophylaxis, clear or not? For prophylaxis. You can easily understand, yeah? So if the patient have atrial fibrillation, again clot, you remember why how patient died in atrial fibrillation? Patient died due to brain stroke and atrial fibrillation because atria not contracting, thrombus formation inside the atria. This thrombosis will go in the form of embolus in your brain and patient die. So for prophylaxis, okay, prophylaxis to stop the clotting, prophylaxis to stop the clotting. Understand? If the physically inactive patient, a patient have big surgery, yeah, patient have leg fracture, or no movement there, more chances for DVT, more chance for thromboembolism, chances for brain stroke, chances for pulmonary embolism. You can use as prophylactically. But how about fibrinolytic drugs, streptokinase, early MI, early, clear? If the patient now in emergency, MI patient heparin. Okay, you can use heparin, but how about streptokinase? First preference streptokinase. Okay, altiplase or retiplase or retiplase. Early brain stroke, early pulmonary embolism, early MI. I must use early. Understand? Thrombolytic you must use early. You must use early when the clot is already formed. When the clot is already formed. Tomorrow we will learn at what time we use platelet, antiplatelet. Okay. Okay, inshallah, see you tomorrow. Assalamu alaikum.
Waalaikumsalam
Uh,
warahmatullahi.
Now, hope so. Anti-clotting system. Now, hope you guys understand well, yeah?
Yes, sir.
Now, drugs are more easy now. Okay, see you inshallah tomorrow. Assalamu
See you, sir.
alaikum.
Thank you so
Allah
much.
Hafiz. Welcome.
Allah